Homeopathy. It is used commonly for common ailments like skin ailments, common cough and cold, and some dust allergy, skin allergy. But what about complex pathology cases? Complex pathological cases are less known to be treated in homeopathy. But what is the scope of those cases in homeopathy? How can it be treated? What are the approaches to deal with complex pathological cases? Today we'll see all these questions to be answered by Dr. Kamlesh Kakde. Welcome to the new episode of Homeopathic Stars of Nagpur. Today with Dr. Kamlesh Kakde. Dr. Kamlesh Kakde sir, he is the director at Heal Within Clinics in Nagpur. He is the mentor and teacher at Wish Academy. He also runs an arts foundation under which he is involved in research projects like for dystonia, autism spectrum disorder, and he is also a teacher and he is passionate about teaching contemporary, conventional, classical homeopathy synergies. I welcome Dr. Kamlesh Kakde sir on Homeopathic Stars of Nagpur. Welcome,
Thank you.
sir.
Thank you.
So, sir, as we all know that you are inspired by Dr. Rajan Shankaran, sir, and you follow the him very proudly, and he is known for sensation method. So, sir, can we all know that how it's your journey, how it has been, आपके स्ट्रगल, आप कैसे डॉक्टर राजन शंकरन से इंस्पायर हुए और आपका मोड ऑफ ट्रीटमेंट कैसे इवॉल्व हुआ उनके मिलने के बाद?
Sure. So, before 17 years ago, I started my practice, and I studied well the classical ways, foundations of homeopathy, all the books I read very thoroughly. And after starting my practice, you know very well that we have a lot of time at the beginning stage of practice. So at that time, I started reading some new methods, approaches, and I was reading different type of methods, all the books, and I used to join seminars, webinars, but I was more attracted towards Dr. Rajan Sankaran's method. So there are some reasons behind that. And the main reason for me is that this method understands the patient in depth, thoroughly. It explains what are our troubles, what are our worries, what are our pains at emotional level, at delusion level, even at sensation level, and how to rectify this. And to understand the person is very much important in homeopathy to individualize it. So that's why I attracted all other methods which I was studying at that time. So these methods were focusing only on treating some pathologies or disease condition, but the way Dr. Sankaran developed, that was to understand that person in depth and to heal that person at that level. So that attracted me, and I can assure you that this method has helped me personally. So I thought if it can help me, then I can help others through this method, and it produces amazing results in practice. So this is the reason why I attracted to Sankaran's method.
So, like, what is sensation method or what is Sankaran sir's method? Can you tell in gist about that method?
Yes, so generally Sankaran sir has developed this sensation method, but we have very limited thought about sensation method, that it is something about sensation only, but this is not completely true. What sensation method is, we need to understand the person in depth first, and second, we need to understand that person on the basis of classical ways, on the knowledge of matra medica, repertory and organon. And when we unite both of these two aspects, then that is a good symptom, that is a good prescription. We should not neglect old ways, and we should not just rely on the new ways, but we have to connect both of these for the benefit of patient. This seems slightly difficult, but believe me, once you are you will be mastering concepts of all the things. Means when you will be mastering matra medica, repertory, as well as this new approach like sensation and super classes, then you can easily and beautifully connect both of these approaches, and that produces very good results. So this is sensation method, to understand the patient in depth, plus to understand that patient, same patient, on the basis of old principles.
So, sir, by this, do you mean that the contemporary methods are different from the classical methods?
See, these classical methods were developed before 200 years, 150 years, right? At that time, the whole condition of society and the whole condition of disease was different. And now, today, the whole condition of society is different. Our thinking process is different. Our diseases are different. Like, for example, now we have more and more of autoimmune diseases. This was not the case before 200 years ago. So, foundation is very important. But at the same time, we need to evolve, right? Like, for example, which phone you are using? You are using latest generation iPhone or smartphone, right? But you are not using that Nokia 1100 which was there before 20 years. You are evolving, your needs are evolving, so as the tools need to be evolved, and tools to be healthy and tools to heal people is homeopathy. And as diseases are evolving, our tool must be evolving. But at the same time, word of caution, but at the same time, our foods must be grounded. We should not forget about our old ways, classical ways. We need to use both of these ways synergistically, and that is the art of homeopathy. See, these classical methods were developed before 200 years, 150 years, right? At that time, the whole condition of society and the whole condition of disease was different. And now, today, the whole condition of society is different. Our thinking process is different. For example, sensation method is based on burning sense way of grand generalization, but it is much more refined clinically, and it is much more practical to use in patients, in today's patients. That is the difference. But basically, it is based on classical methods, and it must be. If it is coming from some random idea, then it is not a good method. It must be based on some solid ground, and solid ground is classical way. Huh? So all these methods, this contemporary method is based on this classical way, but it is much more refined and practical to use.
Okay. So, like, sir, our today's topic is breaking boundaries, homeopathic scope in complex pathological cases beyond common ailments. So, by the meaning of complex pathological cases, so what we are referring to?
So I believe that prognosis in modern science and prognosis in homeopathy is completely different. Homeopath must not read the prognosis part from allied books, because prognosis in terms of homeopathy can be completely different. I have seen lot and lot of such patients, and I was amazed how this patient can get cured of this condition, because all the modern science practitioners, they deny that nothing can happen in this patient. He is going to die within 2 days, maximum 2 days. And in 3 days, that patient walked to my clinic after getting proper correct homeopathic medicine. So I'm amazed how homeopathy can do this. And the answer is, the prognosis in terms of homeopathy is completely different. Yeah. Why? Because we don't treat that disease. We treat that person, that man. Homeopathy is holistic science. And this is the main difference why prognosis is different. So when I say pathological cases, so I don't mean that any tumor or wart or no. These are very simple cases. But pathology means really very difficult cases for which all the other pathies, they say no, it is incurable disease. This is pathology for me, and I'm very confident that we can help lot and lot patients with homeopathy, even in such terminal cases.
So, sir, can you give some examples of these conditions?
There are a lot. Means I have seen lot of coma patients. Like, for example, one coma patient, he was operated for some cerebral tumor, and after that surgery he went into a subconscious state, and then he got fever of pyrexia of unknown origin, and that fever was not reducing even after 18th day of intravenous paracetamol. The fever was constant, and modern science practitioner, they were hopeless that we cannot do anything. Now we need to just wait and watch. Let's see what will happen. And at that stage, uh, relatives came to me, and we prescribed him homeopathic medicine, and within 3 years the fever started coming down. Within a couple of days he was out of ICU, and he walked to clinic after 4 5 days. One of the cases with uh, cirrhosis of liver, and he landed up into coma, and doctors were very hopeless that this patient is going to die within 2 days, so don't even take pain to admit him, take him home. But that patient very beautifully responded to medicine, and within 3 hours he started showing response, and in 3 days he walked to my clinic. So these are the pathological cases. Then other pathies, modern science, even ICU people, they are very hopeless and they say that they cannot do anything, but homeopathy did miracle.
So there are a lot of misconceptions about homeopathy. Like people say that homeopathy can be used only for common cold, or homeopathy can be used for just allergies or non-pathological cases. What cases, especially people need to know that homeopathy can be, it has treatment.
I believe in each and every health condition, whatever terminally ill condition it may be, homeopathy has some role to play, and we must always seek homeopathic treatment. Even if we are taking allopathic treatment, or a patient is hospitalized, even at that stage also we should look for the homeopathic opinion, and that will make a difference. When homeopathy, allopathy, and all other sciences, they will work together, because after all we are working for good of the patient, right? So when we all work together, then results will be much more better. Some things probably they cannot do, I will do. Some things probably I cannot do, they will do properly. So in this way, if we really want the benefit of patient, then we must use this approach to work together for betterment of patient. And as I said, prognosis is homeopathy is not like allopathic prognosis or modern science prognosis. So we must check if homeopathy can do anything in this condition.
So by this, you mean to say that we need to develop an integrated approach
Exactly.
where all pathies have some role to play for the benefit of the patient.
Exactly. And in that way, I'm doing with some of the eminent surgeons and allopaths of Nagpur, and our results, combined efforts, make a really good difference in patient's life. So this is very important.
And so, as per your method of treating or treating these complex pathological cases, so what is your approach? Like the case taking, what you look into the patient, and how do you prescribe? What is the analysis, and when how you arrive at a medicine? Can you share this?
Yes, definitely. So homeopathy is based on two major principles, that is holism and individualization, right? So this is the secret I will tell you today to treat deep pathological cases. Don't just focus on pathology, but on that person who has that pathology. This is the secret, and if you could do this, then results will be different, much more better. So what we do, if patient with coma, so we immediately start looking for the medicine for coma. So don't just do that. If you are doing that for your study, then it's okay, but we are not treating the coma, but we are treating that person who has the coma. And when we try to understand that person and then prescribe for that person, then it will produce miracles. Like what I said, that cirrhosis of liver patient, coma case. So we just not look for the alcohol and cirrhosis of liver, but we try to understand the person. What was his reactions? How was his behavior during the disease and before that also? And when you can see these alterations, like what Dr. Hahnemann has said in aphorism 211, that the state of the disposition chiefly determines the choice of correct homeopathic remedy. So this is the secret. We must focus on this state of the disposition and not the pathology, and then results will be different.
So, sir, in these cases where the pathology is deeply physical, but there are emotional causes too, there are psychological causes too. So, then how to treat and consider those symptoms also?
This is the beauty of homeopathy when we see individualization. So our case taking approach must be individualized for individualized person. We cannot have our proforma and we cannot fit every patient in that proforma. So our case taking approach must be different for different patient. Means, for example, one patient may be sensitive for his chief complaint, so we must focus on his chief complaint. One patient must be sensitive for his emotion, so we must focus on his emotion. So it depends upon not on my concepts, but on what patient needs. This is the best way to individualize. So walk with the patient.
These cases,
Even in case taking, walk with the patient, see where he leads us, try to go deeper. And once we go deeper, then evaluate, then analyze. And the way of analysis may be different. Why? Because we have different type of repertories. We have different type of repertories with different type of philosophies. So if we have, say, for example, good physical symptoms, then we should look for bone emotion. If we have very strong mental symptoms, then we must look for complete symptom, complete repertory, or kind repertory. So everything changes with the patient. In my practice, I don't fit patient into my proforma. but I walk with the patient. I go with the patient wherever he takes me, and patient lead me to the right medicine. I do nothing. I'm a very lazy person. I just be with the patient.
Like the patients have different fears, dreams, and some psychological issues, past traumas. All these are considered.
Yeah, these are very, very important things in case. Why? Because these are uncompensated areas. Because in today's world, we all are compensated, right? Means we are wearing proper shoes and sitting properly. Why? We are compensating. No, this is not nature of animals. We are compensating everything. We are compensating our emotions. But there are some areas where we are not compensated, and these are called as uncompensated areas. For example, our hobbies. Hobbies are not uncompensated. Our dreams, we don't have control over dreams. So these areas are very important. When we explore these areas, then we come to know what this person is. So this is very good chance to go deep into the patient and to understand that patient in depth. So we should not neglect these areas or overlook these areas. These are very significant. You ask very important question.
So, how do we convert this into our symptoms, repertorial symptoms? Like,
We just don't need to convert everything into repertorial symptoms, right? But what is the aim of case taking is to understand the patient, not to convert his symptoms into repertory. In case taking, just we need to focus just on the understanding of that person. And once we understand that person, then there may be some features which need to be converted into repertory. There will be some symptoms which need to confirm with materia medica probably. So this is second part. But in first part, in case taking, we just need to understand that person. And after understanding, then this division come in analysis part. So don't think about what rubric it may be or what is this. Don't forget about this. Just walk with the patient and try to understand that person.
so, like now, can we like all you said about the organon approaches, the method of repertorial use in what, like if the patient has physical symptoms, so we can use body version, or for mind we can use Kent or complete repertory. But sir, can you give an example of your clinic, like how you treated a complex pathological case with the approach?
So as I have given that example of coma patient and the person who got operated for brain tumor, and then he landed up into continuous high grade fever. So what to do in such cases? So I'll just ask relatives that tell me something about this person. How is he? The nature, basic nature of the person. And he said that this person is very angry. He doesn't listen to anyone, never in his whole life. And um, he got some financial uh, problems from his daughter herself. So her daughter did some financial blunder, and he was so angry that he used to say that if she will come in front of me, I will take knife and put in her stomach. So that much anger he has. And after that, he gradually started getting the symptoms of tumor, and then the whole story that he need to get operated, and in in ICUs also he was so irritable, and he doesn't want to talk to anyone, any of the relatives. And so this is the whole case. So
Gradually develop fever.
yes, yes. So what we understood that we have some pathology, but that pathology has some base of constitution, right? And you can clearly see the symptoms of constitution, that he is very angry person, he is stubborn person, and he wants to kill. And which patient can this be? Can this be pulsatilla? Can this be calcarea? So, with understanding of his constitution, with characteristic symptom, we came to the medicine Nux vomica, and Nux vomica helped him immediately. So, this is the way, just to understand the person and to understand the symptom part, the rubric and materia medica of the case, and then combine both of these together. This will give prescription.
To match the profile of patient of similimum. That is the similimum, matching the patient's symptoms with our materia medica.
Exactly. You cannot just put all the rubrics of the patient, mind rubric or physical rubric, and this is the mechanical repertorization, So you cannot do this. This totality and this representation will be completely mechanical, but your analysis must based on understanding of person, understanding of his nature, his depth of perception, and then the pathology, and your rubrics must support this understanding. This is the art of homeopathy, not just the science but art. We should activate both sides of our brain, not just left side but right side too.
So now, can you give advice to the budding homeopaths, like they need to integrate the contemporary methods and the conventional classical methods, and some of the homeopaths are still stuck in treating common ailments. So, what advice you would like to give to those homeopaths?
So my advice is all the answers are there in aphorism organon given by Dr. Hahnemann himself. So we just read aphorism 83, what Dr. Hahnemann has uh, described there, that how physician should be. He should not have some prejudices. He must be alert. He must have faith, and he must go with the patient while case taking. So listen to Dr. Hahnemann, that he himself has said, and you know that in each edition of Organ of Medicine, he came up with some new ideas. Some previously some centesimal scale, decimal scale, and then 50 millisimal scale. So I strongly believe that Hahnemann, if Hahnemann has lived more 20 years, then he has come up with new ideas. So he was open. Why are not we? We must be open, but at the same time we must not forget about the classical ways, the basic principles of homeopathy, but also try to learn new approaches, and this integration will make your life simple, and it will give you confidence to prescribe and to treat even difficult pathological cases. So always try and learn, don't stop learning. So this is my advice.
Thank you so much, sir. It was a great session with you.
Thank you so much.
Today we learned that integration is very necessary. We just are nowadays, it's a trend to follow the schools of homeopathy, different brands of homeopathy. Like we some go through mind method, some go through sensation method, or some go through genetic embryology method and all. But the truth is that we should rely on our organon of medicine, and then we should integrate the both methods and for the benefit of patient, basically.
True. If I will ask you which part of your body is more important to you, if I will say you your left hand is not that important, so cut it off. Is that possible? Will you do that? So homeopathy is like this. All methods are important. No method is of less value or more value. All methods are good. All methods are important. Heart is this classical homeopathy, but limbs are this contemporary methods. And we should learn, we must learn all the methods and try to integrate everything. This is holism. This is individualization. This will give you confidence. This will make your life easy.